The Upper East region of Ghana is identified as one of the most impoverished regions in the country, with an increasing population of over 1 million people. About 87% of the populace is largely rural, and access to quality healthcare has been a major problem. In the year 1994, the concept of community-based health services (CHPS) was piloted for 3 limited districts of the Upper East region. Eventually, CHPS became a national strategy to deliver essential community-based health services involving planning and service delivery within communities in the country. CHPS represent Ghana's flagship approach to achieving universal health coverage through the provision of basic, curative, and preventive integrated care that improves health and reduces maternal and child mortality across the country. In 2016, the Korea International Cooperation Agency (KOICA) began its efforts to find a way to improve maternal and child health through an enhanced community-based health services approach in Ghana through its projects for improving community-based primary health care through CHPS strengthening. CHPS Plus. The project is primarily implemented by the Upper East Regional Health Directorate of the Ghana Health Service with financial and administrative support from KOICA. The Navrongo Health Research Center provides research and evaluation support with additional technical support from external consultants. The Policy Planning, Monitoring and Evaluation Division of the Ghana Health Service in Accra will provide oversight and leadership. The highest decision-making body for this project is the Project Steering Committee (PSC), which is made up of leadership of the Ghana Health Service, Project Implementation Unit (PIU), and advisors and consultants from KOICA. The project targets 13 districts, currently 15, 7 hospitals, 62 health centers, and 120 CHPS zones in the Upper East region. Through series of trainings, appropriate incentive for CHVs, supervision and provision of basic equipment and infrastructure requirement, the 5-year term project aims to strengthen the capacity of Ghana's health workforce and health systems at all levels in the Upper East region to deliver high-quality care, focusing in particular on community health volunteers (CHVs) and community health officers (CHOs) and community health nurses (CHNs) and midwives. Specifically, the projects for improving community-based primary health care through CHPS strengthening (CHPS Plus) will be achieved through the carefully tailored components of enhancing community engagement and support of CHPS, improving the quality of MNCH service at health facilities through skills development and strengthened standard and clinical quality of health facilities. Strengthening health system environment by enhancing supervision and governance, facilitative supervision of SDHMT and DHMT, strengthening digital health information system, and establishing sustainable emergency referral care (SERC). The Enhancing Community Engagement and Support to CHPS component of a project seeks to harness community social organization and leadership to support community health planning and services. The 3 main strategies adopted to achieve this goal were to strengthen the cadre of community health volunteers (CHVs), revitalize community health management committees (CHMCs), and empower CHOs and CHNs for community engagement and mobilization. The trainings focused on helping CHVs to acquire skills in community mobilization, planning of health programs, health promotion and education, performance monitoring on the importance of antenatal care (ANC), and early initiation to ensure that every pregnant woman is identified and provided the services that will help the woman and baby stay healthy during pregnancy and the postnatal period. Community health committees were also trained to play an advisory role to the CHPS staff as well as oversee and supervise activities of community health volunteers. Having initially targeted training 669 CHVs on CHPS and 685 CHVs on ICCM, the project has achieved or exceeded its target and trained 788 CHVs on CHPS and 685 CHVs on ICCM, representing 131 and 100% success respectively. Moreover, trainings for CHMCs, which was targeted at reaching 1,800 committee members, also has achieved the 1,800 members goal, representing a 100% success. All CHVs were equipped with a bicycle for transportation and a volunteer kit comprising branded t-shirts, Wellington boots, raincoats, torchlights, mobile phones, and branded knapsacks. The CHPS Plus project tested the effectiveness of a financial incentive scheme and various non-financial incentive schemes, including a stipend, community recognition, and quarterly performance-based award system. Overall, the paying for NHIS premiums and fees for CHV, a spouse, and up to 2 children below 18 years has been identified as the most cost-effective and sustainable incentive scheme. Under the Improving the Quality of MNCH Service at Health Facilities through Skills Development and Strengthened Standard and Clinical Quality of Health Facilities component, the CHPS Plus project strategized to build capacity of CHOs and midwives and improve the standard of health facilities to achieve desired results. At the end of a project, 297 midwives on essential neonatal newborn care (NBC) and kangaroo mother care (KMC) exceeding the set 200 midwives target, another 178 midwives and 57 midwives and doctors were also trained on safe motherhood and ultrasound respectively. In terms of logistics, a total of 120 CHPS and 69 health centers and hospitals were provided with standard medical equipment. "80 CHPS zones now have functioning and maintained Motor King ambulances to facilitate sustainable emergency referral care, and 120 CHPS have also been provided with simplified registers for client tracing and record keeping." The final component, which aims at strengthening the health system environment through enhanced supervision and governance, facilitative supervision of SDHMT and DHMT, strengthening digitized health information system, and sustainable emergency referral care (SERC), has also seen significant positive results. Supervisors at regional and district levels have been given training in facilitative supervision to build their capacity to carry out supportive supervision. As part of a training, supervisors have learned proper planning, including scheduling of activities and assigning responsibilities. In total, 372 and 363 district sub-district health management teams have been trained on FSVs and leadership respectively. Another 283 and 620 district, sub-district health management teams were also trained on financial management and reporting and project management and reporting respectively. 390 district staff were also trained in emergency triage and treatment (ETAT). And lastly, 73 health information officers (HIO) on data management. All set targets under this component were met, while others were exceeded. The project steering committee (PSC), which comprises of leadership of KOICA, Ghana Health Service, Navrongo Health Research Center, and the Upper East Regional Health Directorate of the Ghana Health Service, is the highest decision-making body of the projects for improving community-based primary healthcare through CHPS, strengthening CHPS Plus, and it held 16 quarterly basis meetings in total. The Navrongo Health Research Center conducted project evaluations, with technical assistance from the evaluation advisors. The goal of a project evaluation was to provide rigorous qualitative estimates of a project on the desired outcome, as well as detailed qualitative evidences that explain the main qualitative impact of a project and a detailed explanation of the processes that led to the quantitative impact. A midline evaluation workshop was conducted to present and solicit ideas and information towards achieving all set targets for the project's major component. The beneficiaries of KOICA's timely intervention under the projects for improving community-based primary healthcare through CHPS strengthening CHPS Plus cuts across institutions and individuals. At the end of a project, a total of 7 districts and regional hospitals received 174 medical equipment, 62 health centers received a total of 1,232 equipment, and 120 CHPS zones also received 1,520 medical equipment, including mobile ultrasound with tablet PC, anesthesia machine, ESG unit, oxygen concentrator, trolley, infant radiant, delivery table, examination couch, ambu bag, delivery set, weighing scale, HB analyzer, among others. Other non-medical equipment provided to CHPS health facilities and health management teams include 4 vehicles, 171 motorbikes, 80 Motor King ambulances, 39 ICT equipment, 820 bicycles, among other CHV items. To formally close the CHPS Plus project, the Ghana Health Service and KOICA held a dissemination event on November 26, 2020 at Alisa Hotel in Accra, Ghana. The event, which was attended by various stakeholders of the project, was characterized by a series of presentations on endline survey findings as well as recommendations and sustainability plan as the project ends. The CHPS Plus project was confirmed to have had tremendous impact on healthcare delivery to the people of the Upper East region. Saidu Ibrahim is a CHO at Apatanga CHPS compound. He recounts how they used to deliver pregnant mothers of their babies before KOICA's intervention with a comfortable delivery bed and equipment.
The delivery bed we used to conduct delivery before KOICA intervention was a small one, which wasn't having this stool that will help the woman climb onto the bed. Initially, we have to lift the woman leg by leg. You lift the other one on the bed and the other one follows. But with this one, she just climbs on the stand, then sits on the bed comfortably, then she lies down.
For Abangbase Ajikwo, who is also a CHO at Pindak CHPS compound, the provision of means of transportation and incentives by KOICA has got his CHVs diligently working to save lives in their communities.
KOICA gave us motorbike and then delivery equipments, beds, so many things. They came in with health insurance for our volunteers and then some allowance to motivate our volunteers. They gave mobile phone raincoats, so many things.
Isaac Bazakim is a community leader and a member of the Pinda Community Health Management Committee. He is happy that CHMC in his area has been revived and is properly functioning now, thanks to the CHPS Plus project.
I must be happy to say KOICA has done a marvelous well. One, since 1982, our community health committee was dormant. It was not even working. It's because of this works of the KOICA we are working. We are now up and doing. Some of us, we now know our duties, we know our roles to play as a member. That is why we have a major role to be playing and to be involving the community people in terms of the CHPS.
And Charity Akintoya hopes to play her CHV role in Zono for the rest of her life.
Since 1998 that I've been a volunteer, and because I have the people of Zono in my heart. When KOICA came, I joined KOICA to still help the community. So whatever problem is in this community, I help to do the work. And I wish I will continue to do it till the end of my life.
The project has made quite a fantastic improvement. If we take community level, they provided 80 tricycle ambulances, which are available in the communities, moving pregnant women and other emergency cases to the health facility from the community level. So this has reduced the delays in arriving at the facilities. And because they provided equipment as part of strengthening the health system, they also provided equipment for the health facilities. So the health staff who have also been trained are able to take care of the pregnant woman. So one of the things that we've seen is improved outcome of maternal health, for example. Maternal deaths have reduced, and then the quality of care that our patients receive has also improved. Many of these have been testified by the patients themselves in terms of the respectful care that they are receiving from our service providers.
Because Ghana is going beyond aid, we have to also improve on our domestic resource mobilization through community mobilization. And this is the way to go. So we are going to learn a lot of lessons from this. And after this, we will then scale it up like we did for CHPS when it started. It started as an experimental work in Navorongo. And then we scale it up to a few districts. And now it's all over the country.
I would say that KOICA has really come to assist the district, because all the cases that are coming from the sub-district, it's not only the district hospital which were supported by KOICA. Most of the basic things that are needed to manage the cases in the sub-districts are also available there. So the sub-districts are able to manage the cases up to a certain level before they are transferred here. And I think that it has really come to reduce our mortality in the district. I want to seize this opportunity and thank KOICA so much so that they will continue to support us the way they are doing, and also promise that those equipment that were supplied to us by KOICA, we will take very good care of it.
Ghana and the people of the Upper East region have tremendously benefited from the KOICA project for improving community-based primary health care through CHPS strengthening CHPS Plus. Today, pregnant mothers and sick children are rest assured of quality health care from well-trained health staff and frequent home visits by caring CHVs. Thanks to the much-needed and efficient KOICA Motor King ambulances, maternal, newborn and child mortality rates have significantly reduced in the Upper East region.
One of the things we are putting in place is that looking at some of the achievements, we need to sustain them. For example, at the community level, we are working with unit committees with these assemblies to make sure that the community structures for CHPS support are sustained, and we are working to integrate them into our normal structure like unit committees, health committees at the community level, so that it becomes easy to sustain, and then also will not bring financial burden to us. Now, on the front of the health staff, one of the things that we are encouraging and working on is on-the-job training, because we are trained staff already. So we are saying that any new staff that comes to any of these facilities should be trained by the staff that have been trained on the job, so that the skills that are in that facilities are perpetuated. I mean, they are not casual just because the person has been trained, either is transferred or leaves for school. And then one important thing that we've also put in place is maintenance of the equipment. Because the project delivered, quite a good quantity of equipment for the 7 hospitals, 62 health centers, and then 120 CHPS compounds. So we've put measures in place for maintenance of this equipment so that they can last long, to benefit our people.
Building capacity of health staff in the area of in-service training is the core mandate of Ghana Health Service. But KOICA CHPS Plus has come in to support us. So as they leave, Ghana Health Service will manage and continue to build capacity of health staff in this area, strengthen the system of working environment. Again, we will continue to collaborate with the community members, the CHMCs, the volunteers, to continue the mobilization of community members. In this way, we'll be able to sustain the CHPS Plus activities.
The Upper East region of Ghana is ever grateful to the Republic of Korea. Thank you, KOICA.